Patients and doctors are now using virtual portals to communicate amid the coronavirus pandemic. Our next guest, small business, provides remote care to veterans and people in need all over the world. Let's bring in Adam Hardage, CEO of Remote Health Solutions, a veteran himself. Adam, we appreciate you being with us on this Memorial Day. Help us understand how business has changed for you all now. This has got to be, in many ways, the only way people can see their doctor.
Well, it is interesting, Leland. Telehealth is a big focus right now, and what's interesting is we're a telemedicine company, and the brief difference is that telehealth is an opportunity for somebody to FaceTime with their doctor, and their doctor can make an educated guess about what's going on with them, whereas telemedicine is the ability to actually provide diagnostic information and data to a physician remotely via the use of telemedicine kits. And the differentiator there is basically guessing versus knowing. And so it gives the ability for a doctor to remotely diagnose, which is really a game-changing technology, we believe. And that's why we got into this business 3 years ago. And I'll tell you, supporting the military and the VA is one of the biggest focuses for us.
Interestingly enough, one of the big issues always in the VA is what to do with veterans who aren't close to a VA hospital in terms of them either being able to see doctors in their local city, how to pay for it, et cetera. Bill working its way through Congress that's got some issues with that. Where does this fall in, and how do you all deal with billing the VA, et cetera?
Right, that's a great question. And so rural access to care is a huge issue for the VA. We've met with Secretary Wilkie. We've met with the head of Connected Care over at the VA. We've been heavily involved over the last couple of years with the VA. And one of the ways that we really help veterans, especially those who are chronically ill or have, let's say, continuing issues, whether that's psychological issues, PTSD is a big thing for, my peers and my colleagues after 20 years of war. I mean, I personally was deployed 6 times to 4 different war zones, and I know a lot of guys and girls that are either worse for wear or didn't make it, which is really quite sad. But one of the ways that we can help veterans is by sending like a telemedicine kit that does those remote diagnostics and has the ability to do that FaceTime as well with the doc. So we can remotely diagnose and follow up on problems and monitor chronic illnesses.
At a time like this, when there's actually so many doctors who are unable to see patients because they were, non-essential or non-immediate needs, how does this work in terms of the billing with an insurance company or with the VA? Are doctors allowed to get the same kind of reimbursements for a telemedicine visit as they would if you came to their office?
Yes, as of the CARES Act and the new laws that have been passed, there's parity for the most part between in-person and telehealth. So my guess is that this is, frankly, the start to the industry, the real start that it needed. It's a sad, unfortunate start. I will say that as a company, we've been working day and night to try and bring solutions to our military men and women downrange around the world and help medics in the field provide better levels of care, and as well trying to help veterans in their homes. And we work a lot on the Medicare commercial side as well. But one thing I'd like to announce, this is very exciting news for our company, is today, and so you're the first to know, we are able to provide the first FDA approved for emergency use at home saliva-based COVID-19 test kit. So that combined with the telemedicine, we can provide both the services and testing, this is just an amazing capability. So I appreciate you having us on to talk about it.
Well, we appreciate your service, and obviously know you're spending part of this Memorial Day remembering the brave men and women you fought alongside who didn't come back. Our thoughts and prayers are with them. The company is Remote Health Solutions out of Virginia, and good luck as you continue to grow the company.
Thanks, Leland. I appreciate it, and let's honor all the veterans and those who have sacrificed and aren't here today. Thank you for your time. Really appreciate you having us.
Well said. Thanks, Adam. Arthel?